You hear a word coming out of the physician's mouth, and suddenly time stops because your head is wrapping around that single word. And when I stopped him and I said, "Are you telling me that he has cancer?" So my husband had surgery, had the tumor removed. Everything came back negative. And 22 months went by. And my husband came home one day, and it was just interesting that that particular day when he had gone to get his blood work results, he happened to bring home a copy of the lab report. I said, well, I'm flipping the page over, and I said, where's your CEA marker? I said, I want to know what your CEA is looking like right now. And this is the cancer marker for colon cancer. So I picked up the phone and he called his primary care physician's office, was speaking with the physician's assistant, and he said, can you tell me what my CEA is? And her response was, we thought that the surgical oncology group was monitoring that. And sure enough, his liver was fully engaged with cancer lesions in all parts of the liver and his lower left lung. We took the scans back to the surgical oncologist to show him. He looked, and he looked very startled, and he said, she was doing all the blood work. And I said, yes, I understand that now, but again, she thought you were doing it. He shook his head and he said, we should have caught this. Again, it's just, I don't know that the outcome would have changed, but it's really hard to look back at the situation and not ask yourself whether or not things could have changed if they knew.
I think all physicians practice with missing information every day. It's, you know where it is. The prescription that the patient was given somewhere else last week, but they can't remember the name of it. It's the lab test that was done in another clinic last week, but it's Friday afternoon and they're closed on Friday afternoon, so you can't get it. So you go ahead and make the best decision you can without little bits of information that you would like to have.
As an information technology person, as someone who's been in healthcare all their lives, I struggled with that because I thought to myself, gosh, have we failed? It's very frustrating. And for me, it's frustrating from the fact that I hoped that throughout my career we could dramatically change. You know, we've miniaturized circuitry and computers, we've developed software at a tremendous pace. Now, can't we do that to healthcare?
I've practiced medicine in a lot of different settings over the course of my life. And I think it's very hard for a member of the public to understand just how hard the job of a provider is. Let's take, for example, a provider in the emergency department, and you come into my emergency department and you're critically ill. I've got to solve a puzzle, and I've got to solve that puzzle quickly. Now, in the old days, what you had to do was solve that puzzle with paper. You had to hope and pray that the person could tell you enough information about their health, or you would call a relative, or call a practitioner's office, or call a pharmacy and get enough information to solve the problem. And you never really could. You could get enough information to feel very comfortable that you probably weren't going to do much harm, but it sure wasn't efficient. And it sure wasn't in the best interest of the individual being cared for, not having all that information. You know, when you read about errors and the other things that can also cause harm, it's because providers, well-intentioned as they are, don't have the information they need. So health information exchange has changed this dramatically, because with health information exchange now, when I see you in my emergency department, I can get pretty quick access to all the medications from your pharmacy. Sometimes I can get access to all of the medications that you take at home, the over-the-counters and the like. I can get access to those allergy lists. I can get access to those notes from your other providers. I can get access to those laboratory reports and see what happened in your other hospitalizations. What is that scar? What did that mean? Oh, it was an appendectomy back in such and such a year. All of that just put together. I just move these pieces here, 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 here. I put them together and I solve that puzzle very quickly, very efficiently. Now, another way that health information exchange solves a puzzle is if you then go back and see your primary care practitioner. Quite often what takes place in the exciting atmosphere in an emergency department isn't transmitted well to that provider. But with health information exchange, the minute you come out of that emergency department, you come back into my provider office in your outpatient setting, that information is right there like that. And so you take the piece here, take the piece here, take the piece here, take the piece here, boom, you solve the problem again and you go on. That's really important for primary care. As you know, primary care providers are under a lot of pressure these days. They have to see a lot of patients. They would much rather spend their time talking to you about what's important to your health, what's important to your life, than trying to go around and get an information here, get a fax there, fill out a form here, get a request there, and put the puzzle together. They would much rather talk about you and make from that puzzle a greater thing about your better health.
Experts tell us that about $660 billion a year, almost a quarter of what we spend on healthcare, is unnecessary spending, doesn't do anything to improve quality. And a lot of that unnecessary spending is in duplicate testing that people don't need. Some of the most common things we see here in the emergency room are headaches, and the routine when people come to the ER with a headache is to get a CT scan. We've had some patients who've had as many as 20 or 30 head CTs over a 2-year period. That's enough to give you brain cancer, even if you didn't start with it.
How do you not believe it'll make a difference when you put information in the people's hands who need it? Technology applied correctly can help hold down costs for people like me, as a patient. It can actually hold down costs for providers. So the business-related benefits are huge alone, but the impact to the patient is potentially undefinable.